Hi, I'm Margaret or Peg Rosenzweig. I'm a professor of nursing at the University of Pittsburgh School of Nursing. I have an endowed chair here in oncology nursing, and I am also the um, vice chair of research in our department within the school. So, if you are a patient or a family member and you are meeting with a member of a palliative care team, or if you do have an illness that you feel like things are not very well managed, I feel like the doctor is great and really, keeping up with the illness part of it, but everything else seems to be falling through the cracks. I don't know who to talk to. You have every right to ask about, hey, is there a palliative care service here that I could be connected to? Or if you are connected to a palliative care service, I wanted to go over with you some of the things that perhaps you could ask about or expect from a palliative care service. So if you are meeting someone who says, I am a palliative care expert, you can say, like, who are you and who are the members of your team? They should offer that introduction, but they may not. Often it is a physician. Palliative care physicians are in great demand right now because there has been an increased request for palliative care, as well as some mandates saying all certain patients in certain categories should have palliative care. So the actual physicians are in great demand and there is a shortage. And so they work within teams more likely, and on the teams almost always will be what's called an advanced practice provider, and that's a nurse practitioner and or a physician assistant. In many instances, they kind of wear the same hat, and they are allowed to prescribe and diagnose and will often be the person that you would have contact with, and you may see the physician for the first visit, and then the APP for subsequent visits, and with a change in treatment, you may see the physician again. That's not uncommon that the physician is managing many patients through the APPs. If you're not comfortable with that, and if you feel like I don't want to be managed by an APP, I really want the physician, then you need to say that. And so accommodations can be made so that you would only have visits with the palliative care physician. But hopefully the APPs are, kind of meeting your needs. There may be a registered nurse who also is coordinating care and seeing you and helping you with many of the visits. And there may be some other social service patients on the team, social service members of the team who would be helping with more of the logistics or some of the emotional support, depending on what role this social service person may fill. And so you should expect to know what every member of the team, who they are, how often they will be working with you, who do you contact if you need anything. So for instance, if you would need pain medication and say an emergency refill is needed or something, you do not want in a time of great distress to be figuring out, I need to call this person, or, kind of being told, oh no, you have to call this or that. You need, particularly for pain medications, if they are opiates or something that would require some reporting, that you have a plan in place as to who will help you with those, how will you get these prescriptions, what if there is an emergency, so that you're not left with additional distress in addition to being in great pain. So that's important to outline. If you're seeing somebody for shortness of breath, if you're seeing palliative care for specific symptoms, who do you call if there is a problem, if there's a need for more prescription or a change in prescription? And how will that work? Do you call this number and wait for a call back? Do you go into a portal? What to expect can really decrease a lot of your distress. I think you need to have a very specific discussion about what are your symptoms and specific areas of distress now. So many people with advanced illness have multiple issues. You can see a problem list in a record that can be very lengthy. But think about, as a patient or family, what might be the top 2 symptoms that could really benefit from this expertise. And so you're not kind of diffusing your precious time with the palliative care team in going to a whole bunch of symptoms that they may sort of start to glaze over, but really focus on what is most distressing to you and what do you think, how could they best help you? And part of that is you coming to the visit, knowing about your symptoms, kind of what's triggering them, what have you tried, what seems to provide some relief for you, what's the temporality or the timeline of your symptoms, is it something that you've had before? All of those things can be very helpful to the team, that you're really a partner with them and trying to figure out what's going on. And then you want to do goal setting. What would be your would you like this symptom to go away completely and never to have this again? Sometimes that might happen. Other times that might not be the most realistic goal. Could you talk to the team about, could we decrease this by 50%? Could I reduce the number of as needed medications that I'm taking? Could I sleep through the night? Some goals that you have that would make for better quality of life for you and less distress. You can also think about how do you want to develop your plan of care? Are you somebody who does not want to take certain medications? Those kinds of issues are very important for you to establish with them so that the team can kind of develop around your specific needs, and of course involving your family to the extent, if you're the patient, involving the family to the extent that you're comfortable, and how much they're going to be a part of this ongoing relationship that you have. So I think you can expect these things from your palliative care team. You should go as a patient and family member well informed so that you are helpful in making the most of the visit. And then palliative care team can help you with managing that. I'll add that sometimes, and in many cases, there just aren't palliative care teams. So we're talking about a palliative care team often from an academic center where these teams are in place. But for the majority, for instance, of cancer care delivery in the United States, there are not specific palliative care teams that are available. But you still, as a patient and family, have the right to ask about these things. And what you then are asking for is your oncologist or your pulmonologist or your cardiologist to wear the hat of palliative care, which can be a little bit more difficult for them. But you need to still say, I need help with symptom management. And what are some resources that I could have? So perhaps the office does have a palliative care service that may be available virtually. They may have some online resources for you to manage the specific symptoms of whatever illness it is that you are dealing with. But to say, well, they're cardiologists, they don't do this, it isn't really okay anymore. You have every right to ask about these things. And if they don't have specific palliative care teams, or for whatever reason your doctor doesn't want to involve them, they still need to provide that, and you can ask them about how you can have access to that in their practice. So continue to ask for resources and information. There are a lot of resources available now online. There's a lot of really good information online that can also help not only in what to do, but in what to ask your doctors and providers to say, would this be a good idea for me? So expect the best, expect quality care.